courtesy of VR Distribution, tonight we are playing Palos, which is a abstract strategy game where each player tries to place their little wooden balls and have the last one on the very top of the pile. There's a little bit more strategy to it involved with that, which will be tricky because we're talking. But I'm joined by a very fantastic guest. Elliot, thanks for coming.
Thanks for having me, Liam.
Thank you. Now, you're a doctor.
Yes, apparently so. It says on my degree.
Can you tell me, while we start playing, I'll go first. So if you end up getting a swear, you can sort of take some balls off, and that helps you win. But basically, we're trying to block each other and keep going up. Can you tell me what's the process realistically of becoming a doctor? Like, I know it's a lot of years of study and then work. What was your sort of journey like?
Yeah, so I think mine's probably pretty standard within the Australian medical system now. So I did 3 years of an undergraduate degree, and then that was supplemented with a 4-year postgraduate medical degree, so 7 years at uni. And then after that, we go into our intern year for a year. I had two residency years, and then I've had 2 registrar years. So in total, that's about, 7, 8, 9, 10, 11 years. And I've still got 3 years to go before I'm completely done. So realistically, that should be about 14 years of training before I completely finish as an emergency medicine specialist.
So, and what, 14 years, then you'll be a bit more comfortable in the I mean, surely by now you're pretty confident in your knowledge and skills.
Well, more or less. Obviously, there's always the finesse to the job. There's always added complexities that we have to work around. But most of the bread and butter presentations that come in every day, you have a pretty good hang of actually how to deal with those patients. Yeah.
So is there a typical sort of day working in emergency?
I think the irony of it is the most typical day is your atypical days. So every day is different. You have no idea what you're gonna find when you go to work, which is what I like about emergency. But you'll likely have a patient who is a trauma patient, so they've had a high energy injury, whether that's a bicycle accident, motorbike accident, car accident, they've been stabbed or they've been shot. They will come through the doors. You will most likely have a mental health patient, so someone who's very distressed through either social or environmental factors or drug-induced factors. And then you'll also likely have a patient of elderly disposition, so 60 years or old, who'll be coming in because they're just not coping at home. So they're the usual 3 patients that you're bound to see, and then in between that, you'll have patients who come in with surgical issues, broken bones, people coming in with rashes, all other sorts of presentations. So it really is a mixed bag in the emergency department.
So I guess that means you really need to have that sort of breadth of knowledge. So the jack of all trades, master of none, but at least being able to recognize, okay, this particular specialty, let's get them down.
Precisely. So it's you've become a specialist of being a generalist. However,
that's a good line.
Yeah, it's something that I tell my junior doctors about emergency. But unfortunately, in the world that we live in now, the specialists assume that you're a specialist in their field as well. So you almost need to become a specialist of the specialists. So people used to say emergency, and general practice for that matter, you need to know a little about a lot, but in reality, you need to know a lot about a lot, which is why I like it.
Because that's one, I mean, obviously very different, but that's one thing I found that I was frustrated with in, being a nursing student looking at doing placements in sort of gen med wards is having 5 different patients with, 5 different body systems or different conditions, and sort of, obviously when you're still training, but struggling to sort of try and understand each, where I like this more specialized nature of something where, yeah, you're not necessarily going to know exactly what's happening, but you have a bit more of an understanding. But for you, it's the draw card of, it's going to be different. Every day is going to be, you might have that idea of the flow and the people around you, but it's going to be different.
Exactly. And you have patients that may require multiple specialty input, but as the generalist, you're still the treating doctor, and you really are advocating for that patient to ensure that they get what's needed in the most timely fashion. I think a lot of people don't realise that in emergency we really are seeing patients for the first time, diagnosing them, treating them, and then hopefully discharging them home within about 4 hours is what what we recommend is the safest way of treatment. So you actually have to think about it a lot of things very quickly with a lot of pressure, which is obviously not for some people, but other people, especially those in emergency, get a big kick out of it.
You've also worked in some regional hospitals as well. How have you found the difference between regional and metro?
Yeah, I think with Metro you have a lot more specialty at your fingertips. So working in the city here, we have neurosurgical specialties at our fingertips, cardiothoracics, vascular surgery, plastic surgery, while up in the regional areas you don't necessarily have that access. So in regional centres you need to learn how to transport patients safely from essentially hundreds of kilometres away down to a city centre. In the city we don't have that issue. But also in the country as well, you get free parking. So there's always a positive from that aspect.
Yeah, no, it's also we're talking like very, very big picture there, but also the staff benefit is it's a bit more convenient.
Oh no, totally. Like the fact that when I was up in the country, I was a 3-minute drive to work in peak hour traffic with free parking compared to an hour drive in peak hour here with parking, which is $18 a day, which is already subsidised. There are some benefits to the job being in the city.
Yeah, so we're actually seeing one of the components of the game that we haven't touched on because we keep blocking each other. But if you get 4 in a square, you can then take off 2 of your balls that aren't supporting anything else to use for leader, which is sort of a big advantage.
So what I'll do is I'll purposely make sure you win the next time, and then we we can show the audience that's how that happens.
Yeah, it's an ego thing. It's a requirement of being on the show. Please let me win.
That I did actually have to sign a waiver to say that I would let you win. I'll put one there.
Thank you very much for sort of giving us sort of a little bit insight into sort of what the day of a life of a trauma doctor is and the sort of where you're working. It's
no worries.
Much appreciated as we play this game. Some of these little like wooden abstract games they're interesting in how they play out. They can be a bit tricky sometimes.
I feel it's one of those games where if you're good enough with mathematics, you could technically work out the optimal move set, which there's a reason I didn't do equatorial studies. But no, I love these sort of games. I think if you played it long enough, you probably would work out the optimal method. But
I guess if your other opponent also knows that you can start blocking each other, and then the
That's
game is
also
back to even Steven.
That's true. Or you get to the case where it's noughts and crosses, where you do the 2 moves and then you both say,
yeah. But thank you very much. Thanks for coming down, Elliot. Much appreciated.
Absolute pleasure, Liam. Thank you for having me.